This story, it's about so much more than just technology. It's really about time. It's about distance, and ultimately, it's about survival. We're going to dive into how a totally new way of thinking about infrastructure is solving one of the biggest crises in African healthcare.
And it all starts right here, with a sentence that just hits you. She took her last pill 3 days ago. That's not a statistic. It's a countdown. It sets the stage for a daily crisis that's happening right now for millions of people.
So just picture this for a second. It's 5 a.m. Before the sun is even up, her day is already defined by this potential emergency. It's a race against the clock, and the clock started ticking the second she woke up. And now, you start to see the impossible math she's up against. Okay, the local clinic doesn't even open for another 3 hours, and a real doctor, that's a 4-hour journey. The barriers aren't just medical anymore, they're logistical, and they are huge.
So she's faced with this impossible choice, her health or her livelihood. She has to work. She has to get her kids to school. So what does she do? She takes a painkiller and just hopes. And listen, this isn't just happening out in some remote village. This is the reality on the edge of every major African city. And her story, you see, it's just one story, a symptom of a much, much larger problem. A problem you can really start to understand when you look at the cold, hard numbers. Let's dig into the really unforgiving math behind this crisis.
It all starts with this one number, 1.55. That is the number of health workers, doctors, nurses, everyone available for every 1,000 people across the entire African continent. Just burn that number into your brain for a second.
So what does that number actually mean? Well, the World Health Organization says the absolute minimum you need is 4.45 health workers. So Africa's 1.55, that's not a gap. That is a chasm.
And here's the really scary part. This problem is getting worse, not better. The shortage of health workers is on track to hit 6.1 million by 2030. That tells you that our old solutions, like just training more people, they just can't keep up.
And this slide, wow, it just lays the disparity bare. In Africa, you've got about 2.9 physicians for every 10,000 people. In Europe, it's 36.6. This shows you the distance isn't just about miles on a road. It's about access to expertise. Your distance literally becomes your diagnosis.
So, okay. People have obviously tried to fix this, right? Governments, NGOs, they've all launched these big, ambitious policies. But time and time again, they've slammed into the same wall: geography itself.
I mean, you can look at Kenya's push for universal health coverage, or Zambia's strategy for rural areas, or Nigeria's big reforms. It doesn't matter. The story was always the same: geography. Gaps in rural access, bottlenecks getting referrals, just plain long travel times. It defeated even the best plans.
But here's where the story takes this really fascinating turn. What if the solution wasn't about building more clinics? What if it wasn't about paving more roads? What if the key to beating physical distance was already in millions of people's hands?
I mean, really think about that for a second. When we hear the word infrastructure, we picture roads, hospitals, power grids. But what if the network we desperately need to connect patients to doctors isn't physical at all? What if it's already been built and it's massive?
And boom, here's the answer. Almost half the population of sub-Saharan Africa are mobile subscribers, and smartphone adoption is sitting around 64%. This isn't just a bunch of phones, it's a huge, pre-existing digital highway that reaches into almost every community. The infrastructure is already there.
And that's the big aha moment behind AfriPharm Health. They looked at this and realized the problem wasn't a lack of infrastructure. It was that we weren't seeing the mobile network as healthcare infrastructure. Their whole idea isn't to replace doctors, but to amplify their reach, like exponentially.
Okay, so how does this whole thing actually work in practice? This is not just some other video call app. It's a complete, 4-part system that's designed to close the entire healthcare loop, from the moment you feel sick to the moment you get your medicine. And it's seriously clever.
So first up, an AI helps figure out what's going on. That's the triage. Then step 2, they use geotagging, which totally solves the problem of not having a formal address. Third, the doctor's prescription gets zapped over to a partner pharmacy right in the network. And finally, a hybrid rideshare system, using local couriers, anyone on the move, gets the medicine to your door. It's a complete connected engine for health.
And the real genius here is how each piece of this system targets a specific real-world problem. The AI cuts down on those long delays just to get a diagnosis. Geotagging means the medicine actually finds you.
The pharmacy network means no more hunting around for a specific drug. And the rideshare delivery, that conquers the final mile problem that stumps so many other systems.
So let's go back to that woman from the beginning of our story. In this new world, her story gets a complete rewrite. That 4-hour journey, that's the first thing that just disappears.
That old reality of waiting and worrying, gone. Instead, she takes action. The doctor isn't 4 hours away anymore. The doctor is right there, on her phone. The consultation happens right then, right there, without her whole life grinding to a halt.
And just like that, the loop is closed. The prescription is sent, it's processed, and the medicine starts its journey directly to her. The whole system is built to bring healthcare to the patient, instead of forcing the patient to somehow get to the healthcare.
And this is why it's so important to see this as something so much bigger than just another app. I mean, look at the definition of infrastructure. It's the basic structures needed for a society to operate. What we're looking at here is a new kind of infrastructure, a digital, organizational one, for health. It's a total game changer. So what's the big takeaway from all this? It's a simple idea, but it's also completely radical. Where you live should not determine if you live. It's this powerful statement that with the right thinking and the right tools, geography no longer has to be a life sentence.